What's Up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 7, 2021. Understanding the CDC's Guidance for Vaccinated Individuals with Dr. Tara KIRK. Thank you, Johns Hopkins Bloomberg School of Public Health.
I'm Lindsay Smith-Rogers from the Johns Hopkins Bloomberg School of Public Health. Yesterday, the CDC released its much-anticipated public health guidance for vaccinated individuals. And today, Dr. Tara KIRK, a senior scholar at the Center for Health Security, is going to talk about what this guidance says and why it's so important. Dr. Sell, thank you so much for joining us today. Can you start by breaking down what the CDC guidance says about vaccinated people and precautions for COVID-19?
Well, thanks, Lindsay. It was a really exciting day yesterday. The new guidance issued by CDC is really meaningful because it's one of those first steps towards getting out of the pandemic and this mess that we're in and getting back to things that we've really missed. So the guidance really says that vaccinated people still need to take some precautions against spreading COVID-19, but that they can start doing some lower risk activities.
And what are some of the nuances here? For example, the guidance states that gatherings should be no more than 2 households.
Right. So the CDC doesn't want several households of unvaccinated people to get together, even if it's with a vaccinated household. But it does say that a household of vaccinated people can get together with a household of unvaccinated people with no masking or social distancing. So, for example, my unvaccinated family just moved in with my parents who are vaccinated. And so while our house, is getting some work done on it, this is allowable under CDC guidance.
What activities remain risky even for vaccinated people? And here I'm thinking about large indoor gatherings, maybe indoor dining, weddings, things like that.
So I think at this point, we're looking at a gradual return. So, this is especially since so many people don't have vaccine. And this means that large gatherings or crowded indoor dining, packed churches with a lot of singing are still something to be avoided.
And what should vaccinated people consider when weighing personal risks in returning to some activities like going to the gym or dining indoors?
Yeah, so the vaccine does a great job in reducing severe disease. But while studies seem to be pointing towards the idea that vaccination reduces transmission of disease, we still aren't sure. So vaccinated people should weigh the local epidemiological conditions, like, if there are a lot of disease in the community when resuming their activities, and try to limit things that could lead to the spread of the virus. So if it were me, I'd choose one lower risk thing that I've really wanted to do for a while and do that. And then I'd go slowly on the rest.
And I know this is going to be a popular question as we head into the season of spring break. What does the guidance say about travel?
Well, the travel guidance remains the same, which is that it's currently not recommended. But I do expect that the change, there's going to be changes to that in the not too distant future as we see cases continue to fall and vaccinations increase. And that's barring any curveball thrown at us by the new variants of the disease. But I will say, I think people are tired of being in their houses. The staycation does not seem that satisfying for spring break. So, I would think a driving trip where you can be isolated seems reasonable to me.
And so what should a fully vaccinated person do if they are exposed to COVID-19?
Yeah, so CDC guidance says that they don't need to quarantine unless they start showing symptoms, which is a good sign and certainly something that would be a relief to not have to quarantine for 14 days in that situation.
There's still only a fraction of people in the US that are fully vaccinated, though. So what does this guidance really mean for public spaces?
Yeah, there are no changes for public spaces right now. We still need to mask and distance until more people are vaccinated. So this should be sort of the social norm for public spaces in which a lot of people are in.
Hand hygiene has been a huge public health message throughout the pandemic. I know you can ask Alexa to play a timer for you for 20 seconds to wash your hands. There are timers now on smartwatches. So talk to us about why this is not going away anytime soon, even for vaccinated people.
Yeah, hand hygiene is really just a common sense activity at preventing the spread of all kinds of different diseases. So I think, things that don't have a strong downside are just something to stick with for the duration. So hand hygiene, I think, is something that we should continue to do for all kinds of reasons and not just related to COVID-19.
maybe we'll see a reduction in colds and flu as well in the winters to come. You mentioned earlier that this is really exciting guidance. So what makes this guidance different from other guidance released during the pandemic?
Well, I think that it's more about a return towards the life that we used to have and those moments missed. It has more of a sense of moving forward with vigilance rather than being afraid of something bad happening. And so I think that it's exciting to me because I feel like it's just like spring. Here's a time where we're going to have something new happening. We're going to move forward. And that's exciting to me after a very long and hard winter.
And what advice do you have for people who haven't yet gotten vaccinated? Because we know that there's still quite a bit more demand than there is supply at this moment.
For those people who haven't gotten vaccinated, I would say as soon as it's your turn, as soon as the vaccine is there for you, get vaccinated with whatever vaccine they have for you at the time. I don't think that we need to be picky about the kind of vaccine we get, and I would be excited when it's my turn to have whatever one is available.
And finishing up here, if we think of this guidance as a sort of tier one in resuming some aspects of life that have been deemed risky during the pandemic, what might we expect to see in terms of a tier two guidance?
Yeah, so I do think the guidance is going to change, and people should expect that. The CDC has said that this is interim guidance, it will be changing, and certainly as more people become vaccinated and as we see cases fall, this guidance is going to change, and people should be sure and not think that, oh, it's changed, they just flip-flopped. We know it's going to change. And so the next stage is probably going to be changes to the travel guidance for vaccinated people, and also the broadening of activities for vaccinated people. That will include religious activities, maybe something like indoor dining. And then I think there might be a third tier that we're still holding off on, that we would move towards later, which would be activities with larger groups of people, and perhaps the lessening of masking.
This is all really good news. Thank you so much for joining us today, Dr. Sell.
Thanks for having me.